Ready to roll? Ready to, okay. Okay. Very good. Well, good morning, everybody. I'd like to welcome you to a regular meeting of the Madera County Board of Supervisors. Today is Tuesday, January 19th, 2021. We'll move to the opening and closing in memory of, and Supervisor Wheeler. In fact, let's go ahead with a roll call, and then we'll go to the memorials.
Supervisor Frazier?
Here.
Supervisor Gonzalez?
Here.
Supervisor Rogers?
Here.
Supervisor Wheeler?
Here.
Chairman Poitras?
Yes. Thank you so much. And Supervisor Wheeler, I believe you have a couple of folks you'd like to remember.
Yeah, you know, one of them's been a friend for 40 years, Anthony Simone. You might know him, the Simone's farm on the west side of Fresno, and I think they have a couple places in Madera.
Right. His son worked for me for a while. Yeah, Anthony Jr., his son.
Oh,
Yeah.
okay. And then he's had cancer for a couple of years fighting, and he got COVID, and he died from it in a couple of days. And I just seen him a month ago. His son's driving his sprint car now down at King Speedway, and a couple of months ago they had that last race, and they let in a quarter of the people. So I got down there, and my son and I had seen him, and I used to have the same number he did, 10, and he said I was always trying to copy him. So him and his other buddies used to come up and go fishing at the ranch all the time. And so he's just a character, and he has land up on 211 out of the North Fork Road between Bryant and North Fork, O'Neill's actually. And the other one's John Hildebrand. Hildebrake, I mean, there's two of them. There's a Hildebrand up here too, but this is John Hildebrake. And he's healthy and heck, and him and his buddies, Kaz, and them always play golf together. And his wife got it, and he caught it and died in 3 days.
Oh.
I mean, and healthy and everything. So, and that just happened either yesterday or day before. So that's the two, John Hildebrake, Heltebrake, and then Anthony Simone.
Okay.
So.
Well, very good. Thank you. And any other supervisors have anybody else? Yes, Supervisor Gonzalez.
Yes, thank you, Mr. Chairman. I'd like to open and close in memory of a dear friend, Margaret Wesley Graham. She's the daughter of the late Virginia Lee Rose and Mr. John Wesley Graham. So,
Oh, wow.
she passed away on Sunday.
You're kidding. Okay, well, thank you. So if there's no other folks, we'll move to the invocation and pledge of allegiance. Pastor Roger Leach of Valley West Christian Center will lead us in the invocation. And I'm going to ask our Chief Probation Officer, Chris Childers, to lead us in the flag salute.
Thank you. This morning, that as we remember those that have passed away, we give thanks for their lives, and we again have prayers for their families. Let's pray. Heavenly Father, I thank you this morning that we have come together to do business for the County of Madera at the Madera County Board of Supervisors meeting. We thank you that as we've come together, is that there's sometimes words that come to us. And Lord, this morning you gave me a couple of words, and you were again using the scripture out of Luke chapter 5, verse number 4, where it says that Jesus said to his disciples to launch out into the deep. They had fished all night, they didn't catch anything, and then you told them to cast out into the unknown. Lord, I thank you that today you're asking us as a county, as a nation, to sometimes cast out into the unknown. And in the unknown, there's great harvest. So Lord, I pray today that as we cast out into an unknown year, we don't know exactly what everything's going to break, but we cast out into the deep, into the unknown, into the future. And Lord, I thank you that we bring in a harvest that is great. Lord, I pray that for our county. I pray that for our community. And Lord, we praise you for these things, and we ask your blessings in Jesus' name. Amen.
Amen.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Liberty and justice for all.
Thank you for the invocation and pledge of allegiance. We'll now move on to public comment, and as a reminder, the first 15 minutes of each regular session are set aside for members of the public to address the board, and they're for items under the jurisdiction of the board, but not appearing on the agenda. The board will take action on any item presented, will not take action on any item presented, otherwise people will be running up here, take action. Speakers are limited to 3 minutes, and anyone addressing the board is asked to print their name clearly on the speaker sheet at the podium and state their name and county of residence for their record. So are there any members of the public who wish to provide a comment, public comment at this time under this definition?
During your version of the purge, the sirens go and then everyone can just put through all of their public projects.
They have 10 minutes to do so.
Good morning, members of the board. I'm Tina Rodriguez, Program Manager for the Victim Services Department at Community Action Partnership of Madera County. I want to share with you this morning that I see much attention centered around environmental factors on the Martha Diaz shelter. And I want to emphasize the importance that I'm waiting on the legal response, the legal guidelines and suggestions for the update to the operations of the Martha Diaz shelter. And specifically, on what's been told that we should do and cannot do. For example, it's been shared with me that it's out of our scope to assist with civil remedies. A first time hearing that in over 20 years. It was never an issue when we were deployed to Las Vegas to assist with the mass shooting. Several attorneys were involved in there seeking civil justice. It's never been an issue at the local level with any of the cases that we've had. We have never been told ever not to assist with referring victims that seek civil justice. The only time it's been brought up is going to be in a record that I'm going to provide to you, in which a local individual offered it for free, and Russ Ryan did get involved in that and did stop that, and I'll provide that to you today. It's none of the other employees in the department have been told not to provide this service, just me and just with this case. And so these are the areas that are gray, and it would be helpful if we had guidance. Is this going to be only Madera of the 58 counties that's going to change this operation? And if so, provide us that in writing. In addition to that, there's been mention of in high profile cases, or there's a big threat to security and life, that perhaps there should be other practices involved there. It's been 4 months and I've not heard anything since then. And in addition to the 3 homicides last year, there's been 3 incidents where we've had to really respond in an urgent matter. And that's why I'm here today. It's for the safety of the population we serve. Thank you for your time.
Thank you. Are there any other members of the public wishing to provide public comment? Seeing none, we'll close public comment and go to the consent calendar. Are there any items of the consent calendar that a supervisor would like to have pulled for further discussion?
Yeah, item C, like in cat,
Okay.
and I'd like to just take it completely off of here so we can discuss it and go ahead and vote for the other stuff, because I want to, unless I change my mind, I'm going to vote no on it, and I don't want to vote no on the other items. So if we could do it separately, I'd appreciate it.
Okay, we can do that. So are there any other items that supervisor would like to pull for?
And I just noticed that when Supervisor Gonzalez rings in, it says Supervisor Frazier, just in case for you today.
Gotcha. Very good. All right. Thank you. So I will accept first of all, are there any members of the public who wish to provide public comment on the items on the consent calendar other than item C? Seeing none, we will close the public comment and I'll accept a motion for action for approval of, or
Move to approve,
action on the
yeah.
consent calendar, other than item C.
Move to approve with all except for C.
Second.
Okay, we'll ask for a roll call vote.
David.
Supervisor Frazier,
Yes.
Supervisor Rogers,
Yes.
Supervisor Gonzalez,
Yes.
Supervisor Wheeler,
Yes.
Chairman Rogers, Chairman Poitras.
Yes,
Vote passes 5-0.
very good, thank you. Now let's move on to item 4C, the Y Green PACE program. And are there any discussion on this item? Any members of the public wishing to make a comment on this item?
Hi, this is Emily from Y Green. Can you hear me?
Yes.
Hi, good morning, everybody. Thanks for allowing me to attend. I just want to follow up on this discussion item and vote today. This is in follow-up to the meeting that was held on December 15th, where there was a vote 4-1 in favor of approving this item by the board. There was a fairly substantial discussion on the item and the opportunities that we have for commercial property owners and residential property owners to benefit from our program being approved, which they want to use specifically. We are an additional option in addition to some of the other PACE programs that have already been approved in Madera County. We are a full, Madera County is a full member of our JPA partnership with RCRC. And so we, like I said, had a pretty lengthy discussion, and the board was voted to approve 4-1 to move forward with adopting our program. So today's discussion and vote is, I would say, more of a formality to follow up on that discussion and move by the board. So hopefully we can move this forward, and I'm here for any questions as they come up on this item.
All right, thank you. Are there any other members of the public wishing to comment on this particular item?
Morning, members of the board. Myra Torres, and I own Realty World Real Estate Professionals here in Madera. And I'm here in reference to the item on the agenda. And I wasn't able to attend that meeting December 15th, but I was able to see it, the recording. And it was a pretty well presented information, except for the homeowner. A homeowner did not come in and really present how does this work for them and how this will impact them. So the solar systems can be beneficial for that. It's actually a requirement for new construction starting 2020. But the homeowner has an opportunity to work with the developer, the builder, to decide what is to their benefit and which way to approach the solar system that they're getting. And what's happening is that when somebody comes to the homeowner's residence, they're at a disadvantage at times because they didn't have an opportunity to do the research and see if this is actually going to benefit them. So I have a local homeowner that I have been helping through the opportunity for them to have to move and need to move, and they have an opportunity to relocate because of the high-speed rail coming through their residence. And they have to sell. Unknown to them, they have this issue with the solar. And this is one of the situations that sometimes is not transparent and fully understood by the homeowner. I would like to invite Margarita Frias to come in and speak and just share her story. It's okay?
Okay, that'd be great.
Would I have the opportunity to respond to those comments when they're finished?
We have about 5 people that are going to respond before you will, Emily. Thank
Okay.
you.
Thank you.
Okay, and we'll give our speaker 3 minutes, our president, and maybe just state your name and,
Margarita Frias,
okay?
and I had to sell my property to the railroad department here in California because they're going to build some project to do with my property where it's landed. And years ago, they had said it was not gonna be happening, but then all of a sudden, they decided to do the project without giving me further notice of the project in their behalf. They did their appraisers or whatever they had to do, their research, but then they bombarded me with the notice of saying that I have to leave my property to give it up. Now I have to find a new property to accommodate to my family's needs. And the solar panels did not work for me at all. They did not explain to me. I'm sorry, it's just very personal and very emotional. We're a low-income family of 5, 2 adults, my 3 children. Right now we're going through the process of finding a new property, which we did. Mary Torres, my realtor, she's been helping me a lot with a lot of issues in regards to my solar panels. They increased my mortgage payment. My taxes went up. My insurance doubled up. My PG&E bill in November was $900, which is for a family of 5. That's more than what we could pay. I received assistance through the Madero Action Committee to help me pay for that bill, which I still owe $300 and something. And that the solar panels, they still owed me a new stove, which they never brought to me. Now, the owner of those companies, which Ace was hired a contractor, Gilberto Cabrera, came out to my property and said, oh, well, you're going to get this, this, and this, and then we'll bring you a new stove. But they never told me what was going to happen with my mortgage payment. Went up from $520 to $800, almost $900. My taxes doubled up 2,000 something. My insurance 2,000 something, plus the PG&E bill. When you open the contract with them, that's when your bill comes in very high. And she said, for me to get it lowered, I have to add more panels to my property. And now I'm going through the process of moving. I have to pay those panels out of pocket through the same proceeds of my property. That to me is not fair. They're not clear of what's going to happen with you in the process. As you go, you claim things here and there. Your bills start going up here and there. And we're a low-income family. We cannot afford that. My husband struggled a lot to make the house payment on time. And this really is really emotional to me. I try to hold my emotions in, but I just cannot. I'm very sensitive. And all these things really upset me because all that money that we were going to get from the new house, from this house to the new one, it was going to be transferred, all the benefits from there. But other than that, I had to be responsible for that bill since we were under contract. And we were deducted $11,500. And if you guys need further proofs, I can give you my email address and start showing the proofs of where everything increased. Plus my PG&E bill, I had to call them and let them know that, you know, I'm going through struggles back and forth. And I'm still not there to pay those $300. Those need to come out of the same proceeds of my, you know, moving expenses and all that stuff. And that to me really hurts me. And it's not benefiting me at all. If people have the loan, the money to do it, then they could go ahead and, you know, pay for it up front. But so it won't affect their personal things as it did to me.
Okay, well, thank you,
And
Martin.
then one more thing. The contractor that was hired through the PACE program is actually out of business, going bankrupt, because of people suing him back now for the having all these issues and things that were promised and they never were given. So
Okay,
that's
well,
my brief
thank
summary.
you.
Yeah, I have a question. What was the name of the company that did
Gilberto Cabrera, Solar City. Solar City, Gilberto Cabrera.
Okay, and who
In
was
Fresno.
what PACE provider was involved in your program?
Eddie Castillo and the contractor. Those are the only 2 people that came to my house providing me the solar
So
system.
this wasn't Y-Green.
I'm sorry?
This was not Y-Green.
No, it's California First program that they
Okay.
attached all that stuff to my property taxes, and I had all this mess going on.
Thank you, because this is a different company.
No, but
Okay,
it's just
Supervisor,
my personal experience that I don't think it's gonna help other people. If it didn't help me, if you have the money to pay for that things up front, so it
Yes.
won't mess up all the rest of your stuff, then that's fine. But we're low-income family, and we don't
Right.
have that
Thank
extra
you.
money to be paying
Okay,
things like that.
Supervisor Gonzalez.
Thank you. Thank you, Ms. Frias, for sharing your story. My question, I don't know if this is for Maria or for Regina, but
Is the public comment over?
This is, well, it's all, to me, it's all kind of like part of it. So go ahead, Supervisor.
so my question is, do we have a mechanism for removing the bad actors? We have two other companies that the county has allowed to, or has contracted with. Is there a mechanism to remove the bad actors?
Good morning, Chairman, members of the board, Maria Castro, General Services. Within the collection agreements, there are termination clauses. So it's just a timing issue. I think for the Hero, there's a 6-month notice, and for both Open Pace and the Y Green we have currently with the city, it's a termination before July 1st.
And then these, I believe in your board letter from December the 15th, it said that there was approximately 15 properties that were delinquent. Is there a prevalent company that is the culprit of that, or is it across the board? Or is there one that's more prevalent that consumers are more delinquent?
I have to check with the tax collector on that particular piece of information.
Yeah, Supervisor Gonzalez, I believe there was about 13 that were delinquent. There seems to be, in the data, there was one that had more than the others. I do not recall which provider it was. We'd have to go back and look or check with Tracy.
Okay.
If I may comment, this is Emily with Y Green. One of the
Emily, you can make a comment when it's your turn, okay? Thank you.
Okay.
Okay. Supervisor, is that it, Supervisor Gonzalez?
No, and just a comment. You know, our office has received the calls from families like Ms. Frias and several other family members who have gotten into this, and not just the delinquents, but there's also family members who or households that get into these types of contracts, and they figure out a way to pay these amounts that have increased their mortgage, their property taxes. I just don't, in my heart of hearts, I just don't think that the tax collector should be a part of this, to be an arm. This is the solar industry, or this private industry. I think that they do well by her own presentation on the 15th, Y Green, and this has nothing to do with Y Green, but it's a standalone industry that I think that the county shouldn't be an arm of. Those are my comments.
Very good. Supervisor Rogers.
Yeah, I think I had one other question for the resident. Did you live in the city or in the county? Okay, and that was the only question I had for you. Thank you. We're talking about a different provider than what you mentioned, and Y Green has a very good track record with homeowners and with the default rate and what have you. And the fact is that this, you can't blame one contractor for the actions of another bad contractor. If that were the case, you wouldn't have any contractors, because there's bad actors in every industry. There are bad actors in the real estate industry who give other realtors a bad name. There are bad actors in the car sales industry who give other car salesmen a bad name. And you have that in every industry. So we need to exercise those mechanisms, and you get enough complaints about a bad actor to remove that actor from the program, and that's what we need to do. And so again, we're talking about a different company here who has a good track record and also has a record of working with RCRC that is unparalleled. And in their work with RCRC, there are many grants for homeowners. These kind of situations I've never heard of occurring with RCRC and with Y-Green. Never heard of it. And it's just not the kind of company that deals that way. And I have firsthand knowledge of this because I sit on the board in RCRC, and I sit on the governance board for Golden Valley, Golden State Finance Authority, which we give out multi-million dollars in gifts to first-time home buyers, to people who are improving their homes, and those gifts are given to help those people who can't afford these kind of programs. So this is not the kind of actor that Y-Green is. Thank you.
Supervisor Frazier?
Thank you. Also, I think it's important to note the RCRC is a band of rural counties. Golden State Finance Authority is not a paid position. There's
Right.
no financial compensation for Supervisor
Exactly.
Rogers. Just wanted to make that clear because it could
Thank
sound
you.
to the public that might.
Right. Thank you
that
for
was a
pointing
big
that
gap.
out. It's all voluntary.
Yeah.
And the public all know who RCRC is, right?
Right, exactly. Yeah, I just wanted to, yeah.
It's rural counties representing California.
Yeah,
Right.
so, but just wanted to point that out. Ms. Reyes, I appreciate you coming forward and telling your story, and I've heard a lot of these. And I had Solar City on a property that I was renting. The landlord had put it on there. I was on the hook, and I think that $900 is probably a true up at the end of the year. I remember I got hit with it. It was $1,500. I remember looking at my bank account, and I thought that I had bought a new pair of golf clubs that I didn't know about, but it wasn't. It just went straight to, and you get the PG&E bill that says it's $7 a month, and you're feeling really great that you're PG&E. But if you look at the back, it says this is what your estimated true-up is, and you almost have to keep going on that as you go. And I remember calling back after I moved out of there 6 months later and had another true-up of $1,200. And so within 18 months, it was $2,700. And I remember calling and talking to PG&E. I wouldn't say talking. I think I was in a higher octave, and just saying, at the end of the day, we're going to find that this was the biggest scam that was ever put on to people. And as I then started doing more research about the different ways, and in that case, I had a lease, and the lease was, you pay a certain amount for and that, I know when that house then went to be sold, Solar City had never even taken me off, so for 2 years, I would have been on the hook, even though I didn't even live at the property anymore. And it had to get through the recorder to take me off. I mean, it's a mess, and that was a big cloud on the title, and that was a lease, and there's all these different options that when somebody sits down and says, and everyone knows, oh my gosh, solar is going to save me all this money, and a lot of the times it doesn't. And so the piece that we're missing that actually Y-Green brings to the table is that education for what it means, what it actually, how it either helps you or doesn't help you. A lot of times the problem comes at the sales point, where the person that wants to sell it and get that commission glances over those things. And so I have still one more question for Ms. Reyes, and this is in regards to why you're having to sell your house, obviously from high-speed rail. And
Yes.
My office works very closely with high-speed rail on a lot of different things with businesses and homeowners. Is your settlement done?
It's already closed on Friday for the escrow, so now we're just waiting for the new property. But since those panels were paid out of my proceeds for the property, I'm assuming they belong to me, but I'm not gonna carry that to my new property.
But we should take a look with high-speed rail and say that was a fixture on the house that should be taken care of.
Yeah, that was addressed, and I sent the contract to them of the original contract for the signing, because they make you give them your home mortgage information and your PG&E account.
So
Even though I had passwords on both of the accounts, they were able to work it out and get that stuff done on.
And through the PACE program, did you buy or is it under like a power purchase agreement?
It was a power agreement.
So like,
And
not a
then on
lease,
top
but-
of it, when they put that solar panel, I forgot to mention it earlier, they don't install it correctly. So when I have my panel from the back, like say I have a breaker go out, and I want to go and fix it and click it back on, I had to call PG&E several times to come and put that power back on to where my bedroom was go, because they would keep breaking the breakers back and forth.
So,
So I have proofs of those phone calls for PG&E, and they even said that the main panel where they connect the solar panels is not correctly, safely to open and close. So they have the panel, the inside.
and
They only
we can't litigate that here or what.
No, I understand, but it's little things that
Because that's something
they,
that would be under the bond and the insurance of the contractor. That has nothing to do with the
No, but it's
PACE.
just things that they didn't install it correctly.
Yeah.
Safely open and
I
close.
recognize-
That's the
I
only
recognize
thing.
that. And so-
Supervisor Frazier and
Yeah,
Kim-
so Myra, if you could, with Ms. Reyes, work with Melissa, let's see if there's anything we can do with high-speed rail, any way that we can help out with that and figure that part out and try and help through that. So that was my questions for you. So if, Myra, if you want to.
Myra, you have a minute left.
Um,
You had 2 minutes that.
I'm sorry, I had to
you-
express myself
Okay.
the best way I can, maintain myself.
Yeah. So we'll try and help out with that however we can. I can't promise anything. I don't know where you're at in that process, but if I can help, that'd be great. And then I have for Emily, is Emily still there?
Yes, I am.
So I know that that Y-Green has a litany of disclosure statements and a lot of the legislation that's come out in terms of how to move through the process through the PACE program is dealt with based on your pattern and practice. When do those disclosure statements to the homeowner, the education piece that's outside of what the salesperson worked with them on, when does that come into place? And is there anything that we can do at the permit point of our counter that ensures that the customer or our residents understand what it is that they're getting into?
Sure, yeah. So our disclosures start right from the very onset of the project application. So whether the property owner is inputting the application or the contractor in the case of a commercial project, that disclosure process starts early on in our program handbook, which talk about all of the rules and regulations and also protections for consumers, even as it relates to our authorized contractors who go through a very rigorous training in order to use our program. And by the way, that's true for all licensed PACE providers. And so the disclosures model the know before you owe set of financial disclosures for all licensed PACE providers. They talk about the interest rate, the term of the loan, exact annual payment that will be due for the assessment term. And then also recently, as of 2018, property owners go through an ability to pay calculation requirement before they're approved for the assessment. So in no way is a property owner approved for PACE financing unless they prove through their income statements and their debt statements that they can afford the increased annual payment on their property tax bill. So there's a lot of safeguards embedded in PACE programs. What I would ask too is that it's very important to separate solar panels and solar installations from PACE financed projects, right? PACE finances not only solar, but we do energy efficiency, water efficiency, fire resiliency, electric vehicle charging, seismic retrofitting. For about 25% of our projects, which are solar related, we help customers own their systems. We do not finance our purchase agreements. So in regards to the customer who spoke, my heart goes out to you for what you're going through. There are ways for you to address this at the regulatory state level, and I can give you that contact information so that you can report your experience and have the right regulators take action on what might have gone wrong. I don't know the particulars of your case, but as an industry, we take this very seriously. And it's very important, and I think only fair, that we make sure we're being specific to what PACE finances and what solar companies may provide through their power purchase agreement. They are totally separate systems. They're not owned by the property owner, and they have all different types of ramifications in terms of the property owner when it comes to refinancing or selling the property.
Excuse me,
So I think
Supervisor
that's
Frazier,
really
did you get your question answered?
I did.
Okay, any other questions?
No.
Okay, very good. And Myra, 1 minute, and then CAO Varney. Thank you.
Thank you.
I want to talk too, Rob, when it's time.
Okay, very good. Right after Jay.
Thank you. You know, we want to be able to be a resource to you as a Realtor organization because we encounter these situations as we're servicing our community. And one of the biggest things that we have is the disinformation that goes out to the community member. Luckily, this is a young family, but when we encounter a disabled or an elderly that, I mean, they're sold a $50,000 unit and they're 90. Okay. It's just does not make good business sense when you speak of PACE financing options and somebody has $100,000 of equity in their home. What is the benefit? So if we can just, as a community, as a county, set up some safeguards that shows the people, this is what you're getting, and it's actually not price gouging. Because I've seen sometimes where a family gets so many panels, similar, the money's like different.
Right.
There is really not a consistency on that, and then they're promised a stove, they're promised this, they're promised that, and that doesn't follow through. So if the county's going to be an accounting department for this PACE financing, I think that it's only appropriate that there's some checks and balances to see that this was a fully delivered. You know, we have a satisfied client. And the other thing is that in the meeting, I noticed that it was compared to an auto purchase.
15 seconds.
Okay, different purchases. When somebody ties in or mortgages their property, this is their home. So it's a little bit different. So if somebody decides, I want to go ahead and get a second on it, they know they're getting a second. They have their first or second, it's there. They can pay into it, bring it down. A solar system can't.
Absolutely.
So,
Thank you.
Please, I want to be the
Okay.
reference.
Yep, you know, we've got Myra. Everybody knows Myra. She's offered from the Board of Realtors to be a great resource. So thank you so much and for representing. Okay.
Thank you.
Very good. CEO Varney.
So in your December 15th item, we didn't dive into what each of the delinquencies was caused by. I just wanted to reiterate that the county's participation in this is merely on the financial side. We aren't part of selling this program. And I don't believe, although I would agree that we want satisfied community members, that we want the county verifying what these companies do. So at this point, I would suggest at the chairman's direction, if you would like, our staff and the treasurer tax collector staff will get together and do an analysis of not just delinquencies, but perhaps if we have any information on complaints that come in so that we can determine which vendor is creating the issues and which type of program is creating the issues. And we'll bring it back to the board so the board can determine if they would like to exercise any of their rights under the existing programs.
That'd be great. Great advice.
Yeah.
Supervisor Wheeler.
Yeah, thank you. Thank you, Jay. I pulled my, lucky I'm home, I guess. I pulled my last, the December 15th meeting, and PACE had 13 properties that were delinquent. And I asked twice about Hero, and I couldn't ever get one, so I don't have it wrote down. But I just worry about this. I'm like Myra said, I didn't think about that. We're not in the financing business. I hate putting that stuff on property taxes. I mean, when I got my solar, if I had to put it on my property tax, I would not have done it, period. There's no damn way. And every time we put that on our property tax, that puts us in that business. And I don't think that we should be doing that. I know they've taken advantage of some of the poor people and older people. And Emily, you guys might be the best company in the whole world. I don't know, but you might have a salesman out there that you cannot control all your salesmen, and nobody can. And hell, my long life, I've bought cars and everything else, and Dare Chevrolet, Chevrolet, and what have you, and somebody's always trying to tell you something that is not true. And I don't trust probably 50% of salesmen. The other 50% are good and they will not ever do that. But like somebody said a while ago, they want their commission. They don't give a damn what they do. They need the money just as bad as the person needs whatever they're trying to refinance. And some people are just low balls. And I don't know. I don't even know why RCRC's in the business of doing this. Why they do a JPA with the kind of company. We're not in the financing company. We're not in trying to help any business like that. All we're trying to do is help businesses perform, not be part of them. And when you put it on our property taxes, we are part of it. And that's what I don't like. And thank you, Jay, for bringing it back. I'm going to vote no anyway. So whatever you guys want to do, that's fine. But I just think we're not in that kind of business. It's just run the county and that these businesses, why are they even doing this? There must be some reason why they're doing this. Otherwise, why did they even have SB 555 and AB 811 to do these? Why are they reaching out for the government to do this? I don't trust them. Thank you.
Supervisor Frazier.
So I think just in thinking about it, it does become a very secure funding stream to pay back the loan by placing it on, and that's why they're able to offer a lower interest rate. That's why I'm happy to hear that Emily said that there is the ability to pay calculator that's in there, because I believe there is no credit check, which a lot of these, you know how hard it is when you don't have the money, the interest rate goes up and you really can't pay for anything. It's this vicious cycle that kind of keeps people impoverished. If you're having to pay 15-20% on your money when you can get it at 6% through a program like this, 6 to 8%, that's a big difference. That's the difference of whether someone can pay for it or not, and that is because of the secure funding stream that these programs provide. So
you're taking business from other contractors?
No, because the contractors they're local contractors. The Y-Green doesn't do the work; they run the program. It's local contractors and the best ones that act correctly are able to then be approved for these programs. So a lot of people are having even harder times because they got a lease or a power purchase agreement that, one, doesn't lower their energy rate. It ends up being the same when you add in all the true-ups. The companies can put a ton of panels on. They use that person's roof or structure as a place to put their panels, and they make money off of those panels, and the person is end up paying still a ton of money, and they still have a cloud on their title when they go to sell it. And those are the people. I would imagine that we had 13 delinquencies or 15 delinquencies under the PACE program. Those are the ones that we know about here. Those other leases and ones that people have done with equity line of credit, or they've done through a power purchase agreement and they can't sell their house, I would venture to guess that there are a lot more problems with those than with this PACE program. We just don't hear about them because we're obviously not collecting for those. But those people are in a lot of hurt and they're not getting any benefit from it. And so I don't like to take away any program that can benefit our residents as long as they're being educated on what it is that they're actually getting, and then that's delivered. And I think we have more control to make sure that that is done through this than we would on those other programs that companies have. So So you know where I'm voting.
Supervisor Rogers.
Yes, I just wanted to say that the program that you see before you now is not what it was 5 years ago, 2 years ago. It's not the same program. This is the most regulated industry now that's out there. It's one of the most regulated industries. And if Tom asked the question, why is RCRC involved in this? RCRC, Rural County Representatives of California, through Golden State Finance Authority, does loans, low-interest loans, and gifts to homeowners who ordinarily have a more difficult time getting financing. And our delinquency rate at the county, or at RCRC, is less than 1%. It's in the minutia category. They have very few delinquencies on that program. And in fact, one of the things that I was concerned about when I stepped onto Golden State Finance Authority, understanding finance myself, I said, we need to have a notice of default on each of these loans. And they said, we really don't need it because the statistics are so excellent for these loan programs. So they do a lot of, they give away, like I said, mega millions. There have been years when we've gifted $20 million in that program to people who could not afford to do the work themselves. They were evaluated. They were gifted the money through the profits of the program. And so RCRC is helping people, and I can assure you that we would not connect with an organization that did anything but help people. Y Green is one of those organizations, and it's not the same program. It's a different program than what we've seen implemented over the last 5 years, last 10 years.
Hey, Dave.
Yeah.
Dave, does Golden State Finance Authority give Y Green money?
No.
When they give out money, you said they give out millions. Do they give? Is that loans or grants or what are they?
We do through Golden State Finance Authority. Sometimes people there's different financing mechanisms through this PACE program. There's different, various ways that a person can finance the project. They can get a personal loan. They can get a loan on their property based on their value. They can absorb it into their mortgage. Yeah, they can get a second mortgage, or they can refinance and absorb it into their first. They can get a loan through RCRC, through Golden State Finance Authority is one of the mechanisms. And when
do that,
and thousands, literally thousands, up into the near hundreds of thousands of people get their loans through Golden State Finance Authority. And as many people that come and get their loans, there are also people who can't qualify for the loans. So RCRC makes sure through Golden State Finance Authority that these people can accomplish their project through PACE, through Y Green, or whatever. And Y Green funnels a lot of these loans to us where people are not capable of paying back the loan. And that's when we come in and we gift the money.
We have to collect for these private companies then. We're the collectors.
We gift the money. They don't have to pay back any money when they can't afford it. There's, like she said, there's a mechanism now where they have to qualify through being able to pay back the loan. So Golden State Finance Authority, when those situations occur, they gift the money. They don't charge them anything.
Okay.
Yeah.
Okay, so say we had 13 of the ones that defaulted. Do they give us the money to make that up?
That wasn't through Golden State Finance Authority, those defaults. They're not, and this is a different PACE program.
Mhm.
So the one that we're talking about now then, Y Green,
Yeah,
right? Okay, so if they have a default, say Tom Wheeler gets it and I default, the Golden State Finance will pay the county that money
no,
because we have to go
no,
collect it.
that,
We got to collect.
it happens in the original deal. They either work through Golden State Finance Authority. We're not connected with Y Green in terms of, or the counties in terms of how that operates. That's a completely, it's just like look at it as a bank over here that does business with, they're brought the opportunity to loan to people. And they'll either loan the money or gift the money.
So they do have grants that.
Oh, yeah. And mega millions I could tell you over the last 10 years, it's been huge.
So how much do you think it cost the county to collect for those, just the ones that I know of, 13 defaults? How much do you think that cost us to go out and try to collect that money and do the sales and do all the stuff we have to do that? Isn't that's work for our staff, our everything. We got to advertise though. We can't just go do it, you know?
Yeah,
I can answer that
have no
question.
idea.
You know, Emily, let's, I think you're done, I think, with your public comment. Sorry.
Oh, I am?
Yes, Supervisor.
Oh, that's unfortunate. I really wanted to respond because we have property owners that were waiting to use our program that spoke last meeting. I wanted to speak on their behalf.
Right. Well, you know, unfortunately, this was
Wait
during
till
the
we bring
public
it back.
comment. So Supervisor Wheeler, Supervisor Rogers, any more comments? Okay.
No, let's just go ahead and vote and do what we're going to do one way or another. I'd like to make a motion to postpone it and bring it back when we have more information on delinquencies from both companies and why this is going to be that much better and different, besides somebody just sitting here telling me. I want to see it in black and white.
I'll second that.
We have a motion and a second to delay the, this item. Let's go to a roll call vote.
Supervisor Wheeler,
Yes?
Supervisor Gonzalez,
Yes.
Supervisor Frazier,
No?
Supervisor Rogers,
No,
Chairman Portress.
No.
Vote fails, 3-0.
I move to go forward with the Y Green PACE program.
Second?
We have a motion and a second. Let's go with a roll call vote.
Supervisor Rogers,
Yes.
Supervisor Frazier,
Yes.
Supervisor Gonzalez,
No.
Supervisor Wheeler,
No.
Chairman Portress.
Yes.
Vote passes 3-2.
Any matter, Ms. Reyes, want to meet with Melissa right here? Maybe we can help out or figure out some way. And Emily, if you're still on the line, if you can send some of that information on the regulators
Yes.
to my office and to the whole board so that when we do have these issues,
Be
we
great.
can direct them to the right places.
I will absolutely do that, and I will make sure that the property owner who spoke has all the resources needed to hopefully resolve the issue.
Thank you.
Thank you.
All right.
Thank
very
you.
good. Let's move on to item 5A, Public Health Department, an update on COVID-19 and current vaccination administration status.
Good morning, Chairman, Board of Supervisors. Can you hear me okay?
Yes,
Great.
loud and clear.
Okay, there's a lot that's going on, and we're also responsive to requests that were made with regards to the content of this update. So if you'll bear with me, there's a fair bit to cover. As you know, California and the San Joaquin Valley is still surging under COVID-19, and our hospital system continues to struggle. As recently as last night, ICU patients had to be transferred to other regions for care. So we're still in a serious place with regards to our hospital surge. Our case rate in Madera County is 81.4, and our positivity rate is 19%. In our HPI area, or those areas that experience some challenges with regards to achieving and maintaining good health, their positivity rate is 22%. And our testing rate is above the state average is at 515 per 100 population. So we're doing really, really well on testing. There is a change that we just recently learned about from the California Department of Public Health that is coming this week. With the surge that's continuing in California, CDPH will be shifting vaccination prioritization to an age-based approach to keep the most vulnerable from being hospitalized. It's not completely clear yet what that will look like, but we do know that these groups are prioritized already, healthcare workers and residents age 75 and older. The next groups are expected to be, and CDPH already rolled out 65 and up, but they will likely encourage us to delineate between 65-year-olds with underlying health conditions versus other healthy 65-year-olds, 65 to 74. And so we're going to be utilizing the CDC definition of underlying health conditions, and we'll post that on our website so that people can become informed about that. We expect that this announcement, kind of an updated chart of what this looks like in California, will be released later this week. Unfortunately, I don't have any more details about that, but we will certainly update the community through lots of communication channels as soon as we have updated information from CDPH. But the bottom line is that we need to prioritize vaccine to the most vulnerable to acute illness in order to keep people from actually being hospitalized and filling up ICU beds and having the poor outcomes that we're seeing in the hospitals. We want to prevent deaths first and certainly acute illness. So that's where the shift is really happening. And we know that it's frustrating for everyone as these changes continue to happen. We'll see how this rolls out, and we will do our best to reduce confusion for the community as we learn more. So the other thing that I wanted to kind of highlight is that you may have seen recent announcements in the delay of vaccine distribution at the federal and at the state level. We were told that second doses were being held at the federal level and that would be shipped 1 month later after our first doses. The stockpile for these second doses, we have learned now, doesn't exist. So what that means is that we have to hold doses that we had originally planned for first doses to be able to give people the second dose, because the vaccine trials they didn't study whether or not one dose was actually going to accomplish what we needed to. And it's too big of a gamble with this vaccine distribution to not follow what we have scientifically proven at this point. If there are further studies to show that one dose could be effective, then things might change. But at this point, we need to continue with 2 doses in order for the vaccination to be effective. But what that does is it effectively cuts in half the number of first doses, the number of people that we can actually vaccinate, because half of the first doses have to be used for the second. Each week, we're notified of our allocation on Tuesday. We don't know at what time of day it's going to come. And we then have to order the vaccine based on what's allocated to us. At this point, we've been ordering everything that's been available and drawing it down because we have storage capacity through partners at Valley Children's Hospital to be able to store it. And we'd rather have it here and readily available instead of sitting at the state waiting to be ordered. So we do not even have our allocation yet for today to be able to look at the rest of this week and what we need to do about the vaccination clinics that we scheduled in good faith more than a week ago. So it puts us in a real bind about knowing what to do and not wanting to set ourselves up for giving a bunch more first doses that we don't have second doses to follow. So we may, and we'll know tonight what we need to do. And we are making phone calls to the state to let them know the predicament that we're in, that we have people scheduled, counting on getting their first doses, and we really want to follow through on that commitment. But if the state does not provide those vaccines, then we will have to cancel some of our clinics this week. And we're ready and we're prepared to be able to notify them through email, make phone calls so that people are aware if any cancellations of registration need to happen. The good news is that we are ready for high volume distribution. When the vaccine becomes available, Madera County is very well situated to be able to vaccinate a lot of people in a short period of time. Since the vaccine became available, Madera County has scaled up significantly, and we are able to provide mass vaccination. We had mass vaccination plans in place, but they were mostly designed around a vaccine that looks like the flu. Well, we know that the COVID vaccine, much different, it's more complicated. There's 2 different vaccines. They each have 2 doses. They have different storage capacities. So the first thing we had to do is completely redo our mass vaccination plans for this new vaccine. We set up an easy online registration system, easy for everyone else. The back end of that was actually quite complicated because of these prioritization tiers and things. We've worked with 311 to be able to provide registration support for residents who do not have computers or internet access, as well as those who have language barriers that make it difficult for them to participate. Although our online registration is in English and in Spanish, we want to make sure that there are no accessibility issues for anyone. And certainly our seniors sometimes don't feel as comfortable doing online registration. We developed and launched a vaccination volunteer program, and this has been an amazing success. It included hiring a volunteer coordinator, setting up the web page, online application, complete flowchart for the clinic, job sheets. All of the orientations are now ready for self-training at home, as well as live Zoom calls to ask questions. And as of Friday evening, we've received 410 volunteer applications. 110 of those are from clinicians. So that's amazing. Also, the Sheriff's Department has been working along with Human Resources to identify county staff that can fulfill non-clinical roles in the clinic. We have 43 staff that are identified already from 8 different departments, and there are more that are responding. We have 56 nursing students that are activated to be able to provide vaccinations with medical oversight in our clinics. So we have a solid system with all of the actual manpower to be able to scale up very quickly as soon as vaccine becomes available. So I just want to highlight that all of this work was done in collaboration with Public Health, Office of Emergency Services, the Sheriff's Office, Human Resources, County Admin, 311, and IT as well. So our realistic capacity with all of this infrastructure that we've built is as many as 3,000 to 4,000 doses per week. And that's first doses in addition to 3,000 to 4,000 second doses. We have that capacity to scale to that place. And then we expect that there'll be some state resources as well. So once the vaccine really starts to flow and maybe there's more vaccines that become available, we do have the ability to vaccinate people really quickly. Many are asking about our goal to be able to prioritize equity. And really, this ability to scale to a lot of people is one of our biggest factors to be able to achieve equity. That we're not limiting populations from actually accessing the vaccine once the allocation is there. But our mass vaccination clinic is actually located in our HPI area. The same is true of our testing resources. We wanted to make sure that as much as possible, we were trying to make it available to those who do have accessibility issues. We recognize that our mountain community is the population. It has a lot of people that fall into that vulnerable population, over 75, over 65 with underlying health conditions. And so we are hopeful that we'll be able to follow through with the clinic that we've scheduled in the mountains on Thursday. Again, we have to look at that allocation. We also are scaling up our ability to be able to go to other remote locations with vaccinations, such as Chowchilla, farm worker communities, the ranchos, and other places. And so we will be doing that as soon as we have the allocation available. When groups become available or eligible for the vaccine, there are lots of distribution channels that we're using. We have an extensive partner list and business list, and we email those partners. Public posting to our website, posting on social media, a news release to every news outlet, including print, TV, radio, and digital. We continue to partner with Madera Unified School District and other school districts across the county to send out information to families in mailers as well as messages through established systems. And many parents are now communicating with school districts and getting messages virtually because of students who are at home and learning at home. So we're using a lot of those standard systems that they're used to get information out. We're also rolling out today, it was posted on our Facebook page already, but we're utilizing a system for emergency response in which people can get text messages with updates about vaccines. And so what you do is you text to the number 888-777 Madera VAX, so Madera VAX, and then you're set up in the system, and then every time we have an update or a new group becomes eligible, that individual will receive a text message to know what the current status is. And then, of course, we welcome any additional ideas about how we can better communicate with the community. One final thing that we wanted to make you aware of is that we do have a Madera County Ag Task Force, and we are working with partners such as community-based organizations, the farm worker community, Farm Bureau, Ag Commissioner, Ag Associations, Leadership Council for Justice Accountability, to be able to have good plans about how to communicate and engage with this population that sometimes have a tough time accessing healthcare services. So I'm available for questions.
Very good. Thank you so much. Supervisor Frazier.
Yes, thank you, Sarah, and thank you again for everything that you and your team has been doing during this time. I know it's very hard, and as a small county that doesn't get quite the same amount of resources as other larger ones, I know you're really stretching it and getting it, doing as good of a job as anybody. If we go pound for pound, I'd put you guys over everybody. So you said that we can do 3,000 to 4,000 per week. What is our average weekly allocation since they've started coming in?
It's been variable and not anywhere close to that.
I know,
So about 1,500 is what we've received and in weeks past. And a lot of that allocation was going towards hospitals, of course, to vaccinate healthcare workers.
Right, so we get that done first, and if you think about the 3,000 to 4,000 capacity, if we're getting 1,500 roughly a week at some point when we're doubling up and someone is getting their first dose and then someone's getting their second dose, we'll need to, do we get about 1,500 out each week? Do we use everything that we have each week?
We have not been giving all of those out because, again, the allocation is first and second dose. So we've gotten about half out, and we're at the place now where today's clinic that's currently happening is going to put us under what we need to be able to actually give out second doses if we don't get allocated anymore.
And those second doses should be like after a month, right?
Correct.
So we're stockpiling those under the assumption that we're not going to get any in a month?
Correct.
So we're having to sit on them?
Right. So we started with our initial doses. The first group of people that will get second dose, the hospitals are starting into those right now for public health. That will start next week, later in the week, before we would start getting into second doses.
And please don't take this as second guessing. This is just me
Right.
trying to figure out how we can deliver this better. If we're not saving those as we get, because we're going to assume that we're going to continue to get some each week. And so maybe if that week that when it's a month out and now we're using all of those new doses for people that are getting their second shot. But in the meantime, we're getting people some level of immunity, whether it's, the 100% after or 99% after this second dose, but if we're getting to like 80% with the first dose or whatever that number is, at least we're getting more herd immunity, more people vaccinated. So if we can get those out and not just stockpile them, and again, I think that's something we should start thinking about, knowing that we're going to be getting them in the future, and hopefully the numbers keep coming up each week in the amount of doses that we get as production comes up and other areas have gotten enough. I don't know if that can work. That's just in my head, kind of taking a gamble, but at least you're getting some level of immunity to a lot of people. Maybe it's not the full immunity. And then when we're talking about like 65 and up with underlying conditions, I have I have a friend who was a firefighter for 25 years, has massive scarring in his lungs, is looking for a lung transplant, but he's not 65, but he desperately, I mean, if anyone's in a high risk category, it's him, who already has, decreased lung function, has worked hard no longer can be a firefighter, so he's not on the front lines. Like, how do they get pre-qualified or able to
Right.
get that?
We hear you, and we've been thinking through that same concern because there are always exceptions to, a broad-based plan. And Dr. Paul is in the process of talking with our healthcare providers with the idea of putting together a review team for outliers that would be able to present the information to that medical team, and that medical team would be able to make informed decision about whether or not that person needs to go ahead and kind of move up in line, so to speak. But we want a formal process that's governed by medical providers for that, just so that people feel like we're treating the system fairly, but that there's an opportunity for individuals like you've described to be able to make their case and get the urgent vaccine that they may need based on what their medical care is. So we're in the process of putting that together. We're going to run it past the state, but we do have a certain amount of local control to be able to make the right decision on behalf of our residents, but we need to put systems in place to make sure we can handle those one-off situations and that it's truly fair.
Perfect. That's a great answer. I appreciate that. And then on because I know a lot of people are frustrated that they hear, there was Sierra Pacific in Fresno was you just come in, show your ID, and that Fresno resident, you're over 65, you get a vaccination. And everyone in Madera is feeling like, oh, well, we can't even go on and pre-enroll at 65. And so if we're able to open up that enrollment to 65 plus, even if with the caveat that says it may be 2 weeks or 3 weeks before we can accommodate it, is there some way we can do that and give give us the amount of time that it takes, over promise or under promise and over deliver, and I think would be, for some people, it's just a peace of mind knowing that they're somewhere in the queue over 65, and if it says 3 weeks, their likelihood of sheltering in place and being more cautious during those 3 weeks until they get it could help in everything, even because we have a light at the end of the tunnel that's not the light at the end of the tunnel, if you know what I mean.
Right, to have some sort of timeline. And
yeah.
We would love to get to a sense of timeline, and we thought we were getting there until the news this week about allocations. So I think we're going to know more in the next couple weeks about what registration we can open up. At this point, I don't feel very comfortable opening up registration even to 75 and up for us because we legitimately don't have the doses to be able to give people in hand, and we don't have information about when those doses are coming. So that's a tough spot.
Yeah.
At the same time, we do have a plan for how to open it up to everyone who's eligible, but to have more clinic spaces that are open to those who are in higher tiers.
Okay, and then my last one, and then we can move on. Like when we talked about the volunteer and the clinicians, my wife is a nurse. When she saw it on, I think it was Channel 26, that we were looking for that. She called some of her other friends that are nurses. They were all going to volunteer, and they couldn't because they weren't bilingual. And
so
I just
yeah.
thought that I understand that there's a huge need for bilingual and to get it out to, but I would imagine there's a higher need for a clinician and to pair them with someone who is bilingual that can
right.
help through that process.
Yeah, I totally hear you because that was actually a miscommunication.
Okay.
So the clinicians were never required to be bilingual. That
Okay.
was not something. It was only non-clinical roles that people were doing like registration and those kind of things
Okay.
that bilingual is really needed. But then it was also brought to our attention that if we have a clinic in areas like in the mountain areas, probably we don't need the same bilingual skills. So we have now taken that off as a requirement. And so I apologize for the miscommunication.
No problem. Yeah, I just wanted to bring that up, and my wife was like, she was so ready to volunteer and go out there, and then it was like she couldn't. So I'll pass that on to
She
her.
can. Please volunteer.
Yeah, and I think she can get 2 or 3 others that'll go up and help too in their
Great.
off time. So thank you. That's all I have.
All right, Supervisor Rogers.
Yeah, I have 2 things I wanted to give you a little feedback from the community. One is that, and I'm sure you've already heard this, that some of our testing partners, and I don't know if all of them or just some, are not representing us very well. And that's an important component of things, whether or not they're identified as part of the county. And anyway, moving on from that, the negative, I have gotten many phone calls from people that I consider to be, they're habitual complainers. But the phone calls that I'm getting are not complaints. They're phone calls of praise for how you've handled the vaccination. And so I just wanted to give you that feedback that people that I consider to be a little bit on the, I wouldn't say they're complainers, that's the wrong word. Cantankerous would be a better word. They're looking for something, you know, and they wanted to call me and text me and tell me how well that was handled. And I thought it was great. So it was kind of a nice switch from where they normally are.
Well,
And,
good. I know COVID has been a tough season for all of you in terms of feedback. And so nice that there's some positive coming through.
Yes, it is. I wanted you to know that.
Thank you.
Very good. Supervisor Gonzalez.
Yes, thank you. Yeah, and I'll echo those sentiments. I've received several phone calls from individuals who have praised the process. So thank you and your staff and all your volunteers for that. My question is regarding the testing efforts. Are we still promoting that? Or is it shifted or what's going on with our Get Tested effort?
We're definitely promoting testing, and our testing level is well above the state average. So we're at, per 100,000 population, we're at 510, which is the highest we've ever been. And so we continue to promote testing through all of our communication channels, and it's certainly important for people to continue to get testing.
Okay. And then this may sound like a silly idea, but we have a captive audience with people coming in and getting vaccinated. Is there a way to do a dual where you're getting tested and also getting the vaccination so that we can move up the tier system, or is that not recommended, or is that even possible?
I think there's a possibility we could do that if we co-locate. I think that the problem with that becomes that there's a certain amount of physical space that we have to have for people to be monitored. So after you get your vaccination shot, you have to sit for 15 minutes, and the clinician needs to monitor you for any allergic reaction. That would be, honestly, it would be really hard. We can look into it for sure. At this point, our testing sites are also like a well-oiled machine, and so it's going well. I think there's an opportunity. We believe that a state resource might be deployed at our fairgrounds, which would be very near to the testing site, in which case we could look at kind of a dual role for that. Well, great idea. Maybe in a month or two when we really have this down and we have lots of vaccine rolling.
Great, thank you.
Very good. CAO Varney.
Yeah, can I?
Oh, yeah.
Can I talk too?
Yes, Supervisor.
Yeah, please just ask me because I have no way to communicate except to interrupt somebody.
Yeah, I was going to ask you after Jay, but anyway.
He can wait after me.
Yeah.
First of all, that 888-777, was it Madeira Vax, V-A-X?
Correct.
Okay.
All one word.
Huh?
All one word. So no space between Madeira and Vax.
Oh, put that down.
And
The second thing is when they were talking about had to be Spanish, Brett said that requirements, that came up too with a couple people, because last Tuesday after you announced that at the board meeting, I put it out everywhere. And 2 or 3 of the nurses that said they had to, and then somebody in your office or somebody told me it was, maybe Bobby found out and it wasn't true. So that they re-registered again, so they're all in. So thank you for clearing that up. And then I've got an appointment at 2:00. Is that still on, or is that?
yes, today's clinics are still scheduled.
Okay, and is that at your office?
It's at, yes. So look
Okay.
for the signs. It's actually in one of the DSS buildings.
Okay, well, I think that registration stuff, I done it myself, and it was really simple. And everybody, one 81-year-old lady texted me the next Wednesday. She says, I'm really having difficulties on a couple of things. I walked her through it. She called me in 10 minutes and said, thank you, thank you. And when Dave was talking about people, the complainers, that I get a lot of them too, they've been really positive about, the way you handle it, the way that registration is. They're just kind of frustrated. I've had to explain quite a few yesterday, especially about how it's not our fault we don't have the vaccines. It's the state and the feds, nothing to do with us. If we had them, we would be getting them out right now, but we don't. So, and I think they understand what you explained it to them. But the one lady that really was kind of upset, she wouldn't even talk to Bob. Bob said, you got to call this lady. I called her, and she got her husband registered, but then she had to go she got her registered, but she went to get something from him she needed from him to finish registering him. I can't remember what it was, the medical card or something. And you got back and it was closed. It ran out. So, but after I explained it to her, I said, it's not our fault. We cannot give the vaccines away that we're going to have the second shot for. So we got to keep that in supply. And they all understand that. It's just that explanation. And I think lately you've been putting out some good information. Like today, I told a lot of people, and her included, to watch the board meeting today because you was going to give a presentation on it. So, and the way you explained it did very, very well. So thank you, Sarah.
Very good. CEO Varney.
Yes, sir. It's my understanding we don't really get a choice from the state. Whatever they allocate to us based on Pfizer or Moderna, that's what we get. Is that right?
That's correct.
So I just wanted to speak to Supervisor Frazier's sentiment. I think we'd all like to be able to trust the state enough to burn up all of these vaccinations. The issue becomes if from, let's say, next week on, public health receives nothing but Pfizer, then all the folks who got Moderna never get a second shot. Yeah, so this is the classic, the state said, hurry up and get your capacity up so we can shove these out to you. They shoved out one big batch, and now they're kind of, I don't know what they're doing, and honestly, I don't think in terms of vaccination distribution, they know what they're doing either. So the only way to make sure that we can complete the vaccination of those folks who've already gone through the first shot is to do this. And just so the board knows, this is a statewide problem. We had discussions about this on a CAO call Friday morning, and some of the other counties are having to do the same thing where they may have 10,000 vaccines on hand, but they can only vaccinate 5,000 people because they have to hold back because of the, I'll say, incongruous nature of the supply chain from the state. So as soon as they get that squared away, we will definitely be pushing these out as fast as we can.
And I know it's got to be, if it's frustrating to me, it's got to be like triply frustrating to you to walk past and see vaccines in there and know that you want to get them out to as many people as possible. I was just trying to help. But that makes sense. I didn't even think about the difference in terms of which vaccines we get, and you have to say that for that one. So, thank you.
Very good. Are there any members of the public who would like to make a comment? Any questions? Thank you so much, Sarah.
Thank you.
Great information. Moving on to item 6A. This would be a discussion, consideration, authorize a letter in support of Senate bills regarding housing and homelessness. Mr. Varney.
Thank you, Mr. Chairman. This is a letter of support to Senator Diane Feinstein's office in regards to the Affordable Housing Redevelopment Act and the Fight Homelessness Through Services and Housing Act. How it would benefit the county if it was enacted would be to allow the county to have more resources to I'll say, save blighted and vacant properties and put them back into the housing stock, either for affordable housing or for homelessness intervention.
Very good. Are there any questions about these letters or these bills?
Kind of like
Move to
it
approve.
used to work.
We have a,
until Governor Brown took it away.
we have a motion.
Second.
Okay, roll call vote.
And public comment, Chairman.
Oh, public comment. Any members of the public? Looks like there's no comment or question.
Supervisor Wheeler,
Yes.
Supervisor Frazier,
Yes.
Supervisor Gonzalez,
Yes.
Supervisor Rogers, Chairman Poitras,
Yes.
vote passes 5-0.
Very good, thank you. And then we have 6B, discussion, consideration, authorize a letter of support of Senate Bill 219 regarding property taxation.
And Mr. Anthony Loza from your Treasurer Tax Collector's Office is here if you have any questions on this. It is a bill that allows the treasurer to have greater ability to respond in regards to tax collections and other things that are severely impacted when the taxpayers are involved in a stay-at-home order.
Very good. Are there any questions?
Does it waive it? Does it just create a time to be able to pay it? Or time, what is the relief? And is it also commercial?
Good morning, Chairman, members of the board, Anthony Loza. So basically what Senate Bill 219 is doing is it's taking existing statute, and what it's allowing the tax collector with more flexibility in regards to canceling penalties, specifically if you have been economically impacted by a hardship caused by a stay-at-home order. So basically, back in March of 2020, the governor issued a executive order giving the tax collector a little bit of flexibility to cancel penalties if you've been directly impacted by COVID-19. So what this does is it extends that order, it codifies that language in the statute.
Okay, and it's just in regards to the penalties cost amount?
Yes.
Okay.
Very good. Any other questions? Any members of the public have any questions?
Move to approve?
We have a motion and a second to approve the subject letter. Roll call vote.
Supervisor Frazier,
Yes.
Supervisor Rogers, Supervisor Gonzalez,
Yes.
Supervisor Wheeler,
Yes.
Chairman Poitras,
Yes.
vote passes 5-0.
Thank you.
Thank you.
Very good.
Chairman
Thank you.
Poitras, I have one other legislative item that I'd request that the board add as a subsequent need item. It came to the attention of staff well after the agenda was posted, and it's consideration of a letter to support SB 74, the Keep California Working Act.
I move that we add it to the agenda. We received it after the posted agenda.
Okay, we have a motion.
I believe David seconded
We have
it.
a second. Okay, roll call vote. To add it to the agenda. You have to add it to the agenda, then we consider it.
That's the
Right.
process.
Right.
Supervisor Wheeler,
Yes.
Supervisor Rogers, Supervisor Gonzalez,
Yes.
Supervisor Frazier,
Yes.
Chairman Poitras,
Yes.
vote passes 5-0.
And I'll add there are copies available to the public here and at the clerk's office upon request.
Move to approve.
Second.
Any members of the public have any comments, questions? Seeing no comments or requests for comment, roll call vote.
Supervisor Gonzalez,
Yes.
Supervisor Frazier,
Yes.
Supervisor Rogers, Supervisor Wheeler,
Yes.
Chairman Poitras,
Yes.
vote passes 5-0.
I think this is a record, 3 support letters for legislation in one meeting.
Yeah.
And 2 to the state of California. That's a record.
You don't see that very often. Yeah, I'm sure these grants will be distributed and administrated expeditiously and efficiently and effectively. Okay, moving on to supervisor and staff reports. Supervisor Frazier,
Like I said, usually I would have my coffee and conversation. We've pushed it tomorrow. We've pushed it to next week via Zoom, and that's all I have to report.
Very good. Supervisor Rogers.
Attended RCRC by satellite. And it was good to.
Can't hear him.
Really,
Supervisor Wheeler can't hear you.
Sorry
He's not
about
saying
that.
anything important.
He's deaf in one ear
Attended
and can't hear out of
RCRC
the
by
other.
satellite, and it was good to make connection with everybody there again. The CEO of the organization that's been there for many, many years, all of the time that I've been there, of the last 11 years, and he is retiring, and so they're in a search for a new CEO. That's going to be big shoes to fill because Greg Norton is probably one of the best managers, best CEOs of an organization I've seen. He's really, really an outstanding person and knows how to put good people together with himself and make that happen in a positive way. You're familiar with Greg too as well.
Right.
Anyway. Oh, none.
There you go.
Jay's right up there with him.
None taken.
None taken. All right, Supervisor Gonzalez.
Yes, I attended the Captaincy Board of Directors meeting, and I also attended the Dr. Martin Luther King services yesterday at the California Rural League Assistance offices. There's a beautiful mural, so if you happen to be in downtown, please drive by. And then I also wanted to thank administration and general services for addressing our Parkwood Park needs. There's some vandalism during the pandemic, and staff was very diligent, and they made the improvements, and so the community is able to enjoy that now. So thank you very much.
Very good. And Supervisor Wheeler.
Yeah, I attended that RCRC celebration last Wednesday or Thursday also, and not attended on Zoom. And Stacy Corliss, our cohort chairman of the board over at Mono County, was put in as the chairman. So I think she'll do a good job, and she looks out for us really good. So I think you'd agree with that, Dave. And then February 4th at 6 to 8, I have my next town hall, and it's on emergency services. And after last night, I believe that they will have a lot more stuff open. I mean, I don't know if any of you got the pictures from Jared of all the roads with trees across. The power's out. Our power's still out. I'm running out of generator right now, and I got to go over to Airbnb houses. Got a big tree over the water tank, and the other one's across the road, and took the power out, and the people are blocked inside. So anyway.
Tom, did you get to attend that discussion they had on forest health and fire and that night? Yeah. That's her focus for the year is forest, wildfire and forest management. Yep, perfect. I mean, it couldn't come at a better time. Yep.
Very good. Thank you. CEO Varney.
Nothing to add, Chairman.
Council Garza.
Thank you, Chairman. The clerk of the board might be taking your announcement, but there are PFA meetings for board member Frazier, Rogers, and Chairman Poitras this afternoon at 1:30 and 1:45, just a reminder. And then also, thank you for the ethics and biannual training that we had last week. We did notice it as a special meeting, but 4 of our 5 board members were there, and we're looking forward to, I know Supervisor Wheeler was doing business that day. So the other training for our staff and our partners is on February 4th, so I'm looking forward to that as well.
You're very good.
I'll be there that day.
Yeah, we missed you.
Sorry about that day. I could not get out of it. So
Yeah, you were
Then we
working.
can all be ethical. Very good. And our clerk of the board.
Nothing to report.
Okay, very good. And with that, we will adjourn and look forward to seeing everybody, well, at least a few of you in a bit. Thank you.
Yeah.
She almost
Yeah, this is, Norm Allender would do this, know when to let the tree fall,
Yeah,
you know?
I wanted to say the same thing. Need to let us hang